and say welcome to this week's, oh, hang on, let me grab Instagram. All these different platforms. So just going live on Instagram. I think we're live over on Facebook, yeah. And then obviously we're live in Zoom. One of the wonders of technology and the online life, I guess. So welcome to this week's live Biomechanics Q&A. Anybody over on Instagram, feel free to post any questions. This is interactive as much as it can be. If you can forgive me on Facebook. It's actually the first time we've gone live in the Biomechanics Q&A group on Facebook. Normally I do it on the Biomechanics Education page, but I'll just let that one run over there. And obviously, Zoom guys, you can post questions as we go as well. So if you really want to catch up on these, we've been running the live Biomechanics Q&A through every lockdown from last March. If this is your first time seeing them and you enjoy it, or you want to go and see what they're all about, you can go over to YouTube, where we've got the Biomechanics Education YouTube channel. And all of the previous Biomechanics Q&As are up there. And we've had all sorts of questions. So we often get common themes. And so this week's session, this one today, is about movement analysis. What I quite enjoy doing is trying to simplify what can be really, or appear to be really complex, and it can be really complex, depending on your level of expertise and training. So what we're trying to do as movement practitioners is understand better. This is kind of generally, as therapists, as movement practitioners, we just want to help our clients move better. The biggest challenge we face is the differences within our clients' bodies. Some of those differences we cannot change, and some of the differences potentially we can change. And so we want to have ways to monitor and measure our clients' movement quality and performance to understand how we can help them. And it might be weight loss, it might be run a marathon. Right now, it might be just purely staying healthy and pain-free. So today's session is heavily focused on movement analysis, as I've said. So again, I'm going to have to generalise. I haven't had any very specific questions come in. I'm just going to have a little look, check in, so that see whether there's anything coming over on Instagram, Facebook, nothing coming in just there. So unless any specific questions come in, I am going to talk generally about movement analysis. Now, there are different ways that we can analyse movement. Most people think of movement analysis as very complex, i.e. gait analysis, video analysis, forces and vectors. It's very kind of heavily science focused in terms of numerics and mathematics and equations and vectors and first, second, first class levers. And that's all very, very interesting. One of the issues with that type of movement analysis is many of us, maybe you included, don't have access to fancy equipment and video analysis. Yes, digital advances allow us to use our phones. We can slow-mo on apps, we can speed up on apps, we can put videos next to each other on apps, and that's brilliant. But understanding movement analysis on a gym floor, through a 2D screen like this, just in simple terms, how do I help Barry move a bit better? It's got a bit of an achy back. That's kind of the end of the process I want to pull this session back to. How can we help ourselves, help clients move better, particularly during lockdown? The last 10 months has, as we all recognise, created this limitation in how we can help clients to move better. Number one, actually being with them, which makes things a little bit easier. Number two, them having access to equipment, manual therapy, a space to move, but also motivation. And so we've got all these barriers right now. How can we simplify understanding how well a client moves or not, and then how to add in a movement-based program, maybe simply through a screen like this. Certainly if you're in the bracket of an exercise professional, and we cannot really work with individuals unless under a very kind of strict regime. I think at the moment, I think it might be one-to-one outside. Bloody freezing! So actually even motivating a client to come and meet us, it's pretty windy, there's some rain outside right now, is a challenge in and of itself. And then doing things online holds risk. There's a lot of group trends online. I'm involved in a project, the Movement Mind project, where we're offering free movement-based classes all week, live, just for a donation towards a mental health charity. Go and check that out. There's a page all set up on Facebook, also on Instagram. It's called the Movement Mind Project. You only have to donate a £5 and you can access all the live classes all week. So even if you're an instructor, it's a great way to see what everyone else is doing and maybe get some ideas. And even as an instructor, I need some help right now with my own motivation. But let's get back to this understanding of how to help a client move better. Now, movement analysis really should be done on a one-to-one basis so that we can really hone our analysis to that particular individual. And that's predominantly because everybody moves differently. We have different length femurs, we have different joint design, we have different injury history, and we really need to have all that history in advance before we ask a client to move in front of us to understand if there's any limitation there prior to asking them to do something. All that into place, we could simplify the concept of watching a client doing a squat is movement analysis. Just getting them to find a space. So you're watching a client online like this and you say, okay, Barry, do a squat for me. And you look at how easily he sits down. Maybe he's kind of struggling. Maybe he's kind of butt winking quite early. Maybe he's uncomfortable. Maybe his feet are super wide or narrow. But so what? What does all of this tell us? Because when we look at gross movement, i.e. squat, which is using ankle, knee, hip, probably a bit of spine, a bit of stability. There's a whole bunch of things going on in that gross movement analysis, sort of compound movements, big movements where we're using multiple joints, tissues and actions. Because if they're limited in a squat, for example, and by the way, it's a great benchmark. I still advocate a squat as a benchmark. You ask somebody to squat down and you see what they're doing, and you can alter it, you can get the feet wider or narrower, you can see the way they move. I think it does give you a good insight into their confidence around movement. Another one I really like is just get up and down off the floor, which sounds kind of weird, but if you're watching somebody and their model of getting down on the floor is kind of like they're kind of here, and they make a lot of noise, you know, rather than someone who says, okay, what do you want me to do now? It speaks a lot about their confidence in movement. You can see that some or all or a few of their joints may be limited, and so I certainly advocate those. And I think Dan John talks about in his book, I think it was Intervention, if you like resources, I'll drop a few of those in here as well. Dan John is a strength coach over in the States, and he advocates that model of analysis. Sounds really simple, but how much is it telling us? It's telling us a very generic view of how well a client generally moves in their skin around their environment. Getting up and down off the floor is a key component for somebody who's an older population, they're at home alone. If they fell over, can they get off the floor? Squatting, we do on a daily basis, getting in and out of position, off the bed, into a chair, into the car. So again, it's another good indicator of a client's degree of healthy movement throughout their body. But let's kind of start to funnel vision down to, okay, so if you're watching a client do a squat or get up and down off the floor and they don't do it very well, what does that tell us? How do we help? Where do we start? And I think that's really where a lot of people come to my school, Biomechanics Education, to understand movement better. what we try and do is pull everyone all the way back to level 2 anatomy training. So even if you out there are level 3, level 4, or level 5, maybe you're a therapist, I will always find it most useful in terms of language and analysis to come all the way back down to level 2, level 3. Level 2 generally, I think we might tip a little bit into what's taught on a level 3 anatomy qualification. Understanding the skeleton is the best way of understanding movement. I think one of the limiting factors to understanding movement is when we're trying to think in muscles. When we think in muscles, musculature, sort of myofascial connection is very complex. Now, unless you are very confident with your understanding of origins and insertions of muscle movements and actions, that can make movement analysis very complex, very challenging. So if you pull it all the way back to understanding the skeleton, and what I mean by that is abduction, adduction, rotation, flexion, extension, this I find is the most helpful way to understand movement when you're watching somebody. Does the hip flex? Does the hip flex confidently well through full range? Is there a bit of rotation when they flex? Is there some limitation? So understanding individual areas of the body and how they're supposed to move can help us then understand gross movement. So that when you're watching a client do a squat or getting up and down off the floor, we can start to break down potentially where the limitations are coming from. So what I wanted to take you through on this particular session is a little sort of way that we introduce movement analysis to try and help us when we're looking at gross movement. Now, I don't for any minute mean to patronise anybody, but what I'm doing here is speaking to whoever's watching this, and some people might be watching it back later on, so I'm going to put it right back down, and I don't mean to patronise you. Feel free to answer, by the way, but I'm going to speak to hopefully every level of movement coach trainer out there to see who's in here, see if there's any questions come in, and to help to then build it back up. So we break it down to then build it back up. So what do I mean by that? So I'm going to give you a single joint action, and I'm going to talk through the way we learn about movement. And so if I was to do this movement and say, which joint is moving, you would be saying, what's the shoulder? Yeah. Then we break it down into, well, the agonists and the antagonists. So what's the agonistic movement? So what's producing that movement? Well, it's abduction of the shoulder, and the opposite movement would be adduction. So the agonist group, the prime mover group, would be the shoulder abductors. Now, the first place people go is delts. It's the delts. If we look at the 3 delts in detail, they do a whole plethora of things. So let's keep it really simple and just call it the shoulder abductors. And then in our mind, as we process movement analysis, it's a much simpler vocabulary and language in translation when we're talking to another professional. And this is something that clinicians do really well, and exercise professionals kind of lose that habit, because we always talk to clients about arms and legs and bums and thighs. Whereas in the medical world, they talk a lot between each other, they transfer information between each other more than we do, and so they get that practice. So we have our prime movers, which would be the shoulder abductors. So the antagonistic group is the opposite, and that would be the shoulder adductors. So we've filled a couple of boxes. We then have what we would classify as synergists. So muscles that allow the agonists and antagonists to do their bit in terms of the movement. So what could we do with this synergist group? Because there are 2 types of synergists when a joint action is occurring. We have both fixators and dynamic stabilizers. Now, sometimes this vocabulary, I'm just going to let my dog out, he wants to go and protect me by the bit. There's a squirrel or a bird or something. So a fixator and a dynamic stabilizer group, they're both synergists. They're both going to work alongside the prime movers and antagonists to allow movement to happen or to help movement in some way. The language of their names, fixators, dynamic stabilizers, they kind of tell you what they're doing. A fixator is going to fix you so that you can perform the movement. So by definition, it's isometric. Isometric meaning static, not moving. So it's in a static contraction to allow you to produce the movement. So a fixator during shoulder abduction would probably be, so if you can imagine, if I've got a dumbbell, pretend that's a dumbbell, I'm lifting a dumbbell, so that's a weight, and as I lift my arm, the center of gravity is going to shift. If my fixators were not isometrically contracting, then my body would tip over to the side through the law of gravity. So the fixator group would be, you would assume, the core. And hopefully as I do my shoulder abduction, the core would be the fixator group. Now I'm going to keep this simple. There's a whole plethora of other things going on, I'm aware. But I just want to keep it simple for now. So the core is the fixator group. But through the law of gravity, as I'm doing that, there is a portion of the core, or the trunk, or excuse me, of the fixators that are going to be working harder. And it's going to be the trunk muscles on the opposite side that are working harder to hold me upright. They're going to work harder than this side. So as I abduct the arm or the shoulder, the fixator group on the opposite side of the trunk will be dominant in that motion through the law of gravity, which is going to pull me down that way. So we can classify the whole of the trunk as a fixator, but one side as dominant. So if you're programming some core exercises, have a look at the movement and think, is one part of the core working harder than another? Yeah, probably. So which side of that trunk or core is working hardest in that movement? Am I programming a very flexor dominant core program? Could I look at my programming design to work the whole of the core? Does that make sense? And then we've got dynamic stabilizers. So dynamic means they're moving, so they've got to be changing length. Now, in real simple terms, a dynamic stabilizer is a muscle that is changing length while you perform a movement, but it is not a prime mover or an antagonist. So that means it's probably going to be every other muscle that crosses the moving joint. I'm going to say that again. What I'm aware of is we learn this language at level 2, level 3, and then we don't practice it. So it's usually at this point people go, all right, hang on a minute, slow down. I get you. Let me just go through that again. So a dynamic stabilizer is going to allow the arm to abduct, so the prime movers are the shoulder abductors. Adductors are the antagonists. So anything else that crosses the shoulder joint has to be moving. It's a moving joint. It's got to be dynamic. So what other movements does the shoulder do? What other movements can it do? Well, it can flex, extend, or horizontally adduct, whatever language you want to call it, internal, external rotation. So the muscles that perform those movements are probably changing length, but they're not prime movers or antagonists. Now, it's at this point, if you really know your anatomy, you're going to be challenging my statements and saying, well, hang on a minute, some muscles could be doing a bit of both. Yes, I agree. Here, I'm just talking the very basics of understanding movement in a simple language. So we're forgetting the muscles just for now. The joint that's moving is the shoulder. The prime movers are the shoulder abductors, because that's the action we're performing. The antagonists are the adductors. The fixators is the core, predominantly the opposite side. And the dynamic stabilizers are any other muscle that crosses the joint that isn't contributing to the prime movement or the antagonistic movement. Does that so far make sense? Hopefully it does. Just check in, see if it has posed any questions. We've got a few over on Instagram. Hey there, Marina. Welcome into Facebook. Okay. So we've just done a single joint action of, it's effectively a lat raise. And what we've learned about that movement is when you do a lat raise with one arm, actually you can condition the opposite side of your trunk. So we might be thinking, well, okay, well, yeah, I get that. That's fine, that's kind of easy. But what we're doing here is we're practicing a method, we're practicing a system of individual joint breakdown and joint actions. We're practicing forgetting the muscles for now to understand movement first. It's very easy to go from level 2 and then into level 3 and get so stuck in trying to remember all these muscles, these 600 muscles, that we forget that beautiful, simplistic nature of understanding movement at the level 2 process. No matter what level I've trained at, no matter how much I've studied, I most use the level 2 training when I'm communicating with physios, osteopaths, clients, and the language kind of crosses over those different conversations as a more generic way of speaking about movement. So does the hip flex? Does it extend? Is there a problem with rotation? The language and the practitioner will know that. It's very black and white, it's very clear. If I start guessing at which muscle is contributing to the movement or not, or whatever, then that's where sometimes some grey area can kick in, particularly if you really do know your anatomy and you understand that some people have 5 quads, some have 6, some have triple-headed biceps, and we're all designed very differently, and these nuances can change the way we move. So if we simplify movement to begin with, as we start to learn and get more confident with our anatomy and our muscle knowledge, we can then start to layer in a more complex way of interpreting that. So let's analyse another movement, and I'm going to chuck this one out there and encourage some interaction from anybody who would like to, in terms of the language that we've just used. So let's do, let me just move Scully out of the way. And I'm going to do a movement and we're going to talk through it. And if you let me know what you think. Now, one of the things I've learned is when you're analysing movement, we need to define it precisely first, so we're all coming from the same place. So I'm going to lie down on my side, straighten out legs, bend the bottom leg, and then this is the action. So this is going to stay still, and I'm just going to go up and down about 30 degrees. I'll just do that a couple of times so that you can see. And what we're going to do is we're going to analyse that movement. So I'm trying to keep my spine still, hopefully it is. Keep the upper body still, keeping the knee fixed and the foot fixed. Okay. And then you can all analyse me as I get up and down off the floor. Okay. So the first question we ask is, which joint is moving? It's the hip. Yeah, I even told you when I was describing the movement, I was lying on the side, lifting the leg, and so it was side lying hip abduction. That's the name of the movement, that was the movement I was producing. Single joint action again, nice and simple, lying on the side, lifting the leg. So, the joint that's moving is the hip, and the action it's performing is, thanks Marina, well done. The action it's performing is, again, it's in the title of the name of the movement, hip abduction. So the prime movers must be no muscles, but a group, the hip abductors. Then when we look at the antagonists, this is usually the easy bit. This is the bit where I was going, yeah, I know that one, that's adductors. I know that the abductors are the prime movers, the adductors are the antagonists. So now we're going to talk about the fixators. So when you're lying on your side, lifting that top leg, if everything else is staying still, what would be the fixator group? What would be the fixator group in side lying hip abduction? To keep you still, it would be the trunk again in this example. So the trunk or the spine or the core would be no muscles, Amber. So we're trying to avoid the use of muscle terminology as much as we can. So it would be the trunk. However, to come to Amber's point, which part of the trunk would be dominantly loaded through the law of gravity in a side-lying hip abduction movement? Would it be, I'll give you a choice of two, and then you've got a 50% chance of getting it right. Would it be the top or the bottom? So I'm going to give you a minute to have a lie down or have a think about it. And I want you to think about the answer you come up with, why you've made that choice. Would it be the top or the bottom? You got it, Amber, that's it. Yes, Roz, well done. Well done, Marina, it is the core. So, if I lie on this side and I lift the leg, the trunk, the core, we're classing as the fixator group. But would the top or the bottom be dominantly loaded by the weight of the leg? You imagine gravity is going to pull the leg down that way. Even though I'm lifting it, gravity is pulling down that way. What would that gravitational influence have on the trunk? Which way would it pull? And so which side has to work hardest to keep me fixed and in place so that I can abduct the leg? And if you give me a response, please give me a reason why you think that. Because one of the most important things when it comes to helping clients, movement analysis, understanding biomechanics, is always trying to think, why do I think that? If you get really into the nitty-gritty of why you think something, very often you can find yourself finding the answers to a lot of the questions you can have. So yeah, why do I think that? An important role that we have as practitioners in our duty of care is to always have justifications for all of our actions. Why have I prescribed a sideline hip abduction? Because it works the abductors. Okay, well, why did you want to work the abductors? Because I felt that. And so what reasoning can you put behind it? So why do you think the top or the bottom? Interesting, over on Facebook, we've got one saying bottom and we've got one saying top. So think about, okay, there you go, Marina. So yeah, it would actually be the top. So when you're lying doing sideline hip abduction, if you imagine lifting that leg, gravity's pulling you that way, this side of the body would lengthen unless your fixators hold you in place. So it would be the top side of the trunk. Well done, over on Facebook. Those joining in, well done, good. Yeah, it would be. It would be the top through the weight of the leg, fantastic. So can you now then give me some ideas on what would be a dynamic stabilizer? So let me run through what a dynamic stabilizer is again. We've got some answers over. Yes, Charlie. Good. So what would be a dynamic stabilizer in a sideline hip abduction? Remember that the only joint that's moving is the hip. We've already named the abductors and adductors as the prime movers and the antagonists. So where must those dynamic stabilizers be in the body? They have to be, I'm going really slowly to let people type. Type the answers. From the heart with Jess, yes, well done. Yeah, it's going to be the flexors and extensors of that moving hip, because they've got to be moving, they're crossing a moving joint, they're changing length, but they're not producing the movement or the opposite movement. They're going in the opposite direction, they're in opposite planes, but they're changing length. They're allowing the abductors, well done Izzy, they're allowing the abductors to lift the weight of the leg away from gravity without any deviation. We could also class the rotators in there, and yes, if you know your anatomy, I am aware that the abductors do contribute to rotation as well. And again, this is just a simplification process to allow us to give you some tools and techniques to understand movement better. We generally don't have, so when you learn French at school, and then by now I remember bonjour and mon ami and je t'aime, and that's about it. And the songe dans l'arbre, I think that's the monkey in the tree or something. Anyway, when it comes to anatomy, same again. I think one of the biggest things that stops us remembering anatomy is our fear of using that vocabulary with each other. We're afraid to get it wrong. And I think what I want to get you to do is not be afraid to get it wrong. I, for one, would never judge anybody who gets it wrong. I get it wrong. I am one of the worst for getting it wrong. Have you seen my blooper videos, by the way? When I'm making my anatomy videos, I always whack some bloopers on the end to say, look, it's okay to cock it up. You get it wrong. As long as we're not winging it, as long as we're open about it and we say, okay, I got it wrong, I misunderstood, or actually, now you said that, like Marina's done over on Facebook, fantastic. Oh, right, okay. She's not afraid to have a go, and she's not afraid to then publicly change her mind. That's a really healthy way of learning, remembering, and getting more confident about the way we talk about and understand our clients' bodies and movement. That's really good. So well done. So we've got side lying hip abduction, hip is moving, abductors are the prime movers, adductors are the antagonists, fixator group is the trunk, predominantly the top side is holding you still because the weight of the leg would actually pull that hip away and lengthen at the top. The dynamic stabilizers must be crossing the moving hip, so they are the flexors, extensors, and rotators. Fantastic. All right so far. Would you like another one? We're doing all right. How long we got? Oh, we're all right. We're half an hour in. So we're going to do another one. And again, we're going to keep it as simple as I can. I'll demonstrate the movement. You type away. And again, if you say why, that can help. And so, again, in single joint action, I'm going to set up the movement first of all. So imagine prone kneeling. So I'm going to tell you all the answers as I describe the movement, by the way. So listen very carefully. So upper body nice and still, keeping the trunk still. I'm going to keep the knee fixed, and I'm just going to take the leg back and then put it back down. So that's the movement we're analysing. So the first question is, which joint is moving? Keep it nice and simple. Nice, super simple. What joint is moving? First of all, which part of the body is producing the movement? Yeah, I'm going to do that again, Marina. Yeah, no problem. From the heart, Jess? Yes, it is the hip. And the hip is going into what action? So what is the hip doing? Yes, Amber, hip extension, good. Well done. Yes, good. Well done, Marina, you got it. Yes, Roz, well done. Charlie, April, good. So it is the hip and it is producing hip extension. So the hip producing hip extension means the prime mover group of muscles we could call the hip extensors. Good, brilliant, well done. The antagonist group would be the opposite. So what's the opposite of hip extensor group? Hip flexor group. So we've got the prime movers and the antagonists. So then remembering that prone kneeling hip extension movement, what would we maybe classify as the fixator group? So your synergists, Marina, is anything that's not a prime mover or an antagonist, but that is involved in helping you produce the movement. So we're keeping it super simple just now, single joint actions. So, yeah, you got it on Instagram, good. So prone kneeling hip extension, joint that's moving is the hip, prime movers are the hip extensors, the antagonists are the hip flexors. What are the fixators that are going to allow me to produce that movement comfortably, solidly, stably, what is going to be a fixator group. Trunk and shoulders we've got on Instagram, trunk on Facebook. I'd go with that. I told you, didn't I? I said upper body and spine, nice and still. So any muscles that are in the shoulders that are holding me in place, all the shoulder musculature, the trunk, will all be helping to fix the upper body as I take away one base of support to lift that leg backwards. Fantastic. Yes, Amber. Good, good. Well done, Ross. Yep, brilliant. So what then, in those fixator group, would be dominant through the weight of the leg? So remember, there's a dominant part of the trunk, core, shoulders, whatever, fixator group. What is going to be dominantly loaded? If you imagine, as the leg goes back, the weight of gravity is going to pull the leg down, and so that force on the fixator group is going to mean that the back, the front, side, some of that area is going to be working harder than another part. So which part of the trunk and shoulders, which areas, the back, the front, the sides, which would be working hardest through the weight of gravity, pulling that leg down, even though the leg is extending, if gravity is pulling the leg down, what is going to be working hardest? You can just say back, front, same side, opposite side. So back and opposite side of trunk, Roz is saying. What does everybody else think? Lumbar extensors, the back, Amber is saying. So Amber agrees with Roz over on Facebook. The front, oh, we've got a difference in opinion. So thinking about why are you thinking the front or the back? And I'll come to that for those who are saying the front, because it is actually the back. The back is going to be working hardest. So let's just run through that and see why we've got those difference in answers. So when the leg moves backwards, the weight of the leg through gravity is going to pull the pelvis into a posterior tilt. So the extensors are actually holding the spine down and still so that I can lift the leg backwards. However, if you were thinking the front, let me just give you potentially a reason why you were thinking that. Because if you start here, what is the prime, what is holding me up, the flexors or the extensors? Because just in this position, it is the flexors holding the spine in place through gravity. But the minute I use my leg, that changes the load going into the spine. So without movement, the flexors would be dominant. But with the leg coming off the floor, the load of the leg goes into the back, and so the extensors become the dominant fixator group. I hope that makes sense. Doesn't switch off, Jess, doesn't switch off. When your trunk is isometric, the entire trunk will be contributing. What we're understanding here is how some load might go onto one portion of that trunk more. It doesn't switch off another side. You can't, my understanding is you cannot isometrically contract one side. So if it's working as a co-contraction, it will all be fixator, but there will be more load into the back extensors from the weight of the leg and gravity pulling that leg down. So I hope that makes sense. Fantastic. Good. So dynamic stabilizers is the only one we've got left. And then what we'll do is we'll put all this back together again and ask the so what question. Because we've been a little bit technical with our vocabulary. So what would be a dynamic stabilizer in prone kneeling hip extension? Where must it be in the body for it to be classed as a dynamic stabilizer? No problem, Jess. It's got to be the hip, hasn't it? If the hip is the only joint that's moving, anything that's classed as a dynamic stabilizer or a synergist in terms of being dynamic with that, absolutely, you've got it. Yeah, Facebook's all over it. So it's going to be your ab and adductors of that moving hip and rotators. They will be the dynamic stabilizers. Hope that all makes sense. Yeah, abductors, Jess. So yeah, because they are moving, because they're crossing the moving joint, but they're not the prime movers, abductors will be your dynamic stabilizers. And then there's the kind of so what question. What we've done here is a very simplistic process. We've only looked at 3 single joint actions using the vocabulary of what's the joint, what's the action, what is the group of muscles that produce the movement, what are the opposite antagonists. And so we're just getting back into our flow with this vocabulary. Now imagine if we did a 2-joint movement or a 3-joint movement or a squat. So if we analysed a squat, and we're not going to, by the way, because it would be another hour, what joints are involved in a squat? At least ankle, knee and hip. And you might think it's super simple to say, well, it's flexion and extension. But actually, there is something I'm gonna give you as homework. What's my homework? I'd like you to have a look at something known as Lombard's paradox. Lombard's paradox, L-O-M-B-A-R-D, Lombard's paradox. Just so that you can appreciate how complex the wonderful human body is, and how I don't want you to be hard on yourselves when you're watching clients moving and you're trying to do this movement analysis piece, and you're trying to jump from where we've just been to actually watching Barry squat, and you're trying to fit his body into agonist and antagonistic stuff, because it can be very complex. So just have a little read of Lombard's paradox, a little bit of homework till next time maybe. But if we can practice the system of single joint analysis to then analyze 2-joint action, to then put in another joint action, when you're watching a client move, we could purely get them to do that. How does that feel? I can do it on that side, but oh no, I can't do it on that side. Okay, so is there something going on with the shoulder abductors? We might be looking at a squat and the knees caving in on one side, and we think, well, what's that problem? Well, the problem is adduction is the problem with the abductors. We could start to break movement down into the components within their movement quality that they are less able or less capable, or it feels trickier, it looks stiffer, it feels less comfortable. But there's no point in doing that gross movement analysis until we've broken the body down into understanding each component. And what I mean by that is the pelvis. How many ways should the pelvis move? How many ways can we test its movement? The spine, the shoulders, the knees and the feet. So the pelvis should tilt anteriorly, posteriorly. It should also have opposition of lateral rotation or movement, whatever you want to call that, in the gait cycle. So we should have, when we move, we get that rotating forwards one side, back the other, and so on, so that we can move. We could also class at the pelvis flexion, extension, abduction, adduction, external, internal rotation. You could test each one of those. Sounds like a long drawn out process, but over time, if you can practice the very basics of single joint movement analysis, get used to that language, when you go on to further training and CPDs that are online that teach you evidence-based movement analysis, some of the programs that we teach, this stuff makes absolute sense. Unless you can nail that initial process of what joint's moving, what's happening at that joint, it's actually quite tricky. So I try and help my learners to understand, if you think in muscles, it will always be quite grey, or unless you're very confident at it. Even when you're confident at it, it can still be quite grey. But if we just break down movement into flexion, extension, ab and adduction, it's black and white. Does my client hip abduct? Well, they do on that side. That side, it's a bit tricky. They're not so good. So is that the joint, the muscle, the nerve? Then you can break it down into structures and tissues and the substructures. And again, that's where you build back up on your understanding of the way movement occurs, how it occurs in different areas, how we can analyze it and then improve our skill of analysis. Movement analysis is something I'm so nerdy, geeky about, and even after sort of 3 decades in the industry, from a dance history, strength and conditioning coach, British weightlifting, manual therapy and so on. And I still look at movement and I'm like floored sometimes when I see somebody moving, the right foot turns out, and I'm trying to work out, is that turn out from the knee, the hip, or the foot? I still have that. So what I always try and do in these sessions is kind of say, look, we won't have all the answers. There's probably never going to be a point where you always have all the answers. And I think we know that. It's a constant learning process. But if we can learn tools and techniques to increase our confidence and certainly our communication skills with both clients and practitioners when it comes to helping them move better or helping our clients move better, that's where our duty of care kicks in. We're like, right, I know what I'm doing here. I know what's going on, or I can tell the hip doesn't flex so well on that side. Something's going on. I need to refer them, or I need to apply a muscle energy technique, or, you know, you can layer in the other techniques later on. So let's bring that all back together into a close. Where are we at? We've got 15 minutes. Okay, so movement analysis made super simple. Single joint action, think skeletally. Level 2, action, agonist, antagonist, fixator, and look at those fixators and understand if there's more load in one area to another. And that can apply to the way you strengthen the body as well. I think core training gets chucked into a bracket. And if you're training the core, that's it. You're training the whole core. And that's not the case. Well, it is the case. But it's kind of like understanding you can have a core ratio of strength that isn't quite right. So, for example, commonly we can have either flexor dominant strength or extensor dominant strength. And so we lose that balance between the flexors and extensors, because a lot of the training that we provide our clients with is very flexor focused or extensor focused, whichever way around it is. So if we can understand movement and the way it's loading the body in our program design, then we can start to design a program that is more balanced between the flexors and extensors. Right side, left side is kind of a no-brainer. We know if you do it on the right, then you do it on the left. If you do 8 on the right, you do 8 on the left. Understanding those ratios really allows us to really understand how to analyze the movements we're prescribing and understand where we may need to alter that prescription a little bit. If we look at just a little piece here, Stuart McGill did some research. I think it's now on about 170 subjects. He's done it a couple of times to expand the numerics on the case studies, looking at the core strength ratios that we should all really want to aspire to have a healthy set of ratios. Now, you might initially think, well, it would be a 1-1-1-1, and that isn't the case. The extensors should actually be dominant to the flexors, and there's a percentage, and it's different to men and women, and I believe, and I can't remember which one it is, I think the men is 74 to 100 flexor strength, so the flexors are 74% of the extensors. I may have those numbers not right, or it's 86, between 75 and 85% flexor to extensor strength. Now, we can't measure that without fancy equipment, but we could do isometric holds to test the duration, and we do that on the flexors, the extensors, the lateral flexors, to get a ratio of how they compare. And we teach that over on our Spine Biomechanics workshop if you want to have a look at that, or look at Stuart McGill's work in how he presents it in. What we can often find is clients will often be able to hold an isometric plank on one side longer than on the other side. And that might be down to the way they carry or move around. And this is where our analysis of movement and our testing of our clients' movement ability and capacity helps us program design in. Maybe sometimes we just get them to practice core training on one side. That might be where we use asymmetrical training to improve their core ratio of strength. So I've just spun off onto a whole other subject now. I realise that I could talk this stuff all day, so I need to, Rach, I need to shut up and just keep it on, keep it on topic, Rach, movement analysis. So what I'm hoping is that that little kind of nutshell, I teach that in our workshops and in our diploma, and we expand on it, and we look at two joint movement, we analyse those. I remember doing a 4-hour session with my colleagues, my master trainers. We analysed a wood chop, and that went on for hours. It was brilliant. But it's really, how does this help us understand our clients? Unless we understand the basics, when we're looking at individual clients moving with all their history and all their problems and different joints and femurs and hips and shoulders and nerve tensions and so on, it's going to be really hard. There's too much of a difference. Start basic, get really confident about that basic movement analysis, then start to analyse the exercises you're prescribing. Have a look at those and think, okay, is that dominant on the flexors, the extensors? Can I adapt my program a little bit? You can also then watch a client moving and start to break down their movements into, does the hip flex? Does it extend? Does it rotate? You might get them to perform certain actions and try and understand better how one side compares to the other, maybe. And this is all subjective. There are evidence-based programs out there, of course, but these are certainly techniques that we can use. I know, by the way, you're already doing that stuff, but it's how you use it to your advantage confidently. Because you can analyse whether somebody's hip flexes or not, right? You can tell if they can do hip flexion from one side to the other. You can do that. That is a skill that's pretty easy. That's what we're really good at. It's then how we communicate that, how we interpret that, how we use that in our program design, and what we do with that information. Now, I'm aware that I've just had only 50 minutes. This is just a nutshell. There may well be loads of questions. If there are, fantastic. What I love to do is inspire more questions. So I'm going to be back here next week. And what I'd like to do is inspire you to ask more questions. Give me a topic. Let's talk about something else. Did you enjoy this? Would you like to do more of this? Would you like to ask a specific question? However, number one, I don't diagnose online. Please don't ask me injury questions. If you want a diagnosis, please ask a professional who's qualified to do so online, or allied professionals are practicing right now. You can go and see those guys. But I will not diagnose online. Please don't ask me that stuff. If you want to ask generic stuff, or even specific stuff about clients' movement quality, movement analysis, movement testing, biomechanics, anatomy, the anatomy of the hip or the shoulder, brilliant. Let's do that. We can do that in these short snippets, hopefully just help out while we're all frustrated in our homes, restricted in what we can and can't do with our clients. Let's get in the learning environment and just talk about it. So I hope that helped, guys. You're very welcome. Thanks, Marina. Same time next week. Yeah, Marina, loads, please. Send me all your questions. She's sending me all these questions through, bless her. John Kerris over on Zoom, thank you for coming along. And Instagram, Crab Seal, would you be addressing scoliosis? I'd need to expand on that question. If you want to pose me a question, obviously you can tag me in any of these videos. You can find me on social media, obviously, in all these platforms. You can email me directly at rachel@biomechanics.education.com. I want as much detail as I can get from you about your question, because I will just ask you a load of stuff back to be able to answer your question, very much so. If it's a generic question, sorry, Crab Seal, I need more information. Is that for yourself? Is it somebody else? When you say addressing, what do you mean? Because that's a very individual kind of presentation. If you ask me for generics, fine, we can do that next week. So post me a question. Guys, stay safe, look after each other, be kind, and see you next time. Bye, Instagram, and bye over on Zoom, Facebook. See you soon, guys.